Hi, everyone. Welcome back to Youthful Medicine, where we dive into issues related to autoimmunity, obesity, and longevity. I am Dr. Tahir, rheumatologist and obesity medicine specialist, and today we are discussing a very common issue that affects a lot of people. Today, I got a call from one of my patients who said that she feels great because last week when I saw her, she was having pain in her neck, shoulder, and arms, and whatever I did made a huge difference. Specifically, talking about this 48 years old female of a patient of mine who came in with pain radiating into neck and shoulders and shoulder girdle for about a week. This is a classic case of what we call cervical radiculopathy. And today we will discuss what causes it, how it can be treated, and the role of steroids like prednisone or medrol in relieving these symptoms. So, cervical radiculopathy or cervical spine degenerative disease that causes the compression of the nerve roots that come out of our cervical spine and run down our arms and shoulders. This pain can be quite debilitating, and patients usually end up seeking medical help. So one of the roots in the cervical spine, we have cervical spine 7 cervical vertebrae, and the nerve roots come out at each exit, and they can be compressed or irritated because of the herniation of the disc or the arthritis surrounding them, because the spinal bones are connected through small fissure joints. This can happen due to herniated disc, degenerative disc disease, or osteoarthritis, which can lead to bone spur formation. When nerve roots are compressed, it triggers the pain that radiates in the nerve pathway. So a nerve between from the cervical spine at different roots will radiate down your neck, shoulder, and girdle and arms and cause pain. So the pain involves both mechanical and inflammatory mechanisms. Mechanical compression from the bone spurs or disc space can directly injure the nerve, causing pain, numbness, and even weakness. And I've seen patients who have lost their muscles, who have difficulty sleeping, lifting their arms. Even driving can become very difficult. Sometimes they have to ask their family members to come and drive us to our clinic. But inflammation plays also a huge role. When the nerve is compressed or when there's arthritis, the nerve is irritated, there's an inflammatory response which is triggered. This leads to even more sensitivity of the nerves because of the compression and worsening of the pain. So, how do we treat this acute physical compression and inflammatory response in pain? In this case, I prescribed her a course of corticosteroids. Now, one might say, well, did you do an MRI? Did you do an X ray? Yes, we have done an X ray and MRI, and that showed that she has mild to moderate levels of multi level degenerative disease, which is not yet enough to cause spinal cord compression, and she's not a candidate for surgery. But is she a candidate for epidural injection? Yes, a case can be made for this. So, what I did was immediately to try to help improve her quality of life, I prescribed her a course of corticosteroids, specifically a taper of medrol dose pack. Now, sometimes I use prednisone, sometimes I use medrol, and at a later video, I'll tell you which one is better, but medrol is an active form of prednisone and it works quickly. It targets the inflammatory process which amplifying the pain and the cervical radiculopathy case. So prednisone or medrol, it reduces inflammation by suppressing the immune response. It reduces the pro-inflammatory cytokines, the chemicals that are causing inflammation, and prevents the inflammatory cells from migrating into the site of the injury. So more and more cells would not go into this area. Essentially, it reduces the nerve root swelling and pressure on the nerves, leading to pain relief. I have actually used medrol dose pack for the same problem myself, and it was a significant relief. So when it comes to prednisone dosing, it can vary depending on how much intensity of pain is there, how much inflammation is there, and what region of the body you're using. What are other comorbid conditions of the patient? If the patient is diabetic, hypertensive, does they have prior experience of use of prednisone that caused a lot of medical problems, such as emotional issues, depression, anxiety, worsening of their diabetes, hypertension, you have to use a low dose. The Medrol dose pack is a shortest course that usually can help relieve the symptoms, and in most cases, we can use it. But you have to discuss with your doctor your comorbid condition and what is the right dose for it. But you gradually taper the dose within 1 week, in maximum 2 weeks. Okay? And while it provides short-term relief, prednisone does not fix the root cause of the problem, which is usually a poor posture, which could be degenerative disc disease, would be compression of the nerves. And as part of a broader treatment plan, you should also consider physical therapy, posture awareness, exercises, and if needed, surgical evaluation by getting an MRI and consultation with a spine or a neurosurgeon. Now, what are the potential side effects of prednisone? As I talked briefly, while prednisone can be very effective, it is important to be aware that the potential side effects include elevated blood glucose levels, high blood pressure, mood changes, and gastrointestinal adverse effects. And that's why we monitor patients very closely during the treatment plan to make sure that they are able to tolerate the medication. It is crucial to tailor the treatment to each patient needs and their response therapy. To sum up, cervical radiculopathy, neck pain that causes the compression of the nerve roots that radiates down your arm, it could be one side or both sides, can be a painful and debilitating condition. But treatment options such as prednisone, Medrol can give you an immediate relief of pain by addressing the inflammation. However, it is important to remember that steroids are just one part of the treatment. If you found that this helps you, that means you have inflammation. Now you should also look into how the inflammation can be further controlled and discuss it with your physician and your other health care providers. If you found this video helpful, please subscribe to my channel, like this video, share it with a loved one, and I will continue to produce useful, reliable information for you. Until next time, take care of yourself. See you in the next video.